Welcome to Shea Dental. We're so happy and excited that you are here trusting us with your dental health. Patients here are treated like family. From the moment they walk in, to all the services being rendered, to even checking out, you are truly treated like a special VIP patient. At Shea Dental, we're very high tech. In fact, we're the highest tech office you can be. We want that because we want to ensure the highest providing services are rendered to our patients. With that technology, we're efficient. We can do a lot of your dental care all in one sitting because we know you don't love to be here. We want to get you in, we want to get you out, we want to make sure you're comfortable and at peace while you're getting your dental care done. Thank you for coming to Shea Dental today. We really hope you enjoyed your appointment. If you have any questions or concerns, talk to any of our team members. We want to make sure that your experience was great, we were friendly, helpful, and most importantly, that you are comfortable today with your dental care.
Hi, my name is Carla and I'm the office manager here at Shea Dental, and I just want to go over what you can expect when coming to Shea Dental for your dental needs. You'll walk in and you'll say hi to Josie and I up at the front desk. We'll greet you with a smile and we'll have you fill out the necessary paperwork to go in the back and start your dental treatment. We pride ourselves in only keeping you in the waiting room for about 5 minutes. We want to make sure that this is a quick and easy visit for you every time you come into Shea Dental.
Calculus is just plaque that's been left on your teeth and hasn't been removed. If it's left there long enough, it mineralizes and turns into a hard substance, and that's what calculus is. A lot of people know this as tartar. If calculus is left untreated and not removed, it can turn into gingivitis, which will eventually lead to periodontitis, bone loss, and eventually tooth loss. It's very important that you come to the dentist regularly. That way we can remove the calculus/tartar before it gets worse.
So with the CT scanner, we're able to capture infections and abscesses years ahead of time compared to traditional 2D x-rays. Every 6 months you come in, we take those 2D x-rays. Those are great for catching cavities in between the teeth, but if you want to check for anything in the bone, infections, abscesses, broken bones, broken roots, the best way to do that is with a 3D CT scanner. One of the added benefits of our 3D CT scanner is it checks for airway issues. So if you're having trouble sleeping at night, we can actually evaluate your airway to see if there's any compression zones to see what we can do, such as making appliances to help you sleep better at night.
Maintaining your gum health is very important to your overall smile and also your overall health. How do we maintain our gum health on a regular basis? It's very important that you floss every day. If you need help flossing, any one of us here at Shea Dental can show you the proper way.
Having straight teeth is not just only great for great smiles and straight teeth, but it's also really good for your health. When you have straighter teeth, you actually reduce the chance of periodontal disease and cavities. The reason for this is if your teeth are scrunched up together, it's harder to clean both flossing and self-cleansing with your tongue. So by straightening your teeth with our invisible aligners or Invisalign, we're able to get you a straighter smile, a nicer smile, but also a healthier smile for your overall health. Hello, how you doing?
Good, how are you?
Great to see ya.
Good to see you too.
So I heard you're coming in for Invisalign.
Yeah.
You want to get straighter teeth?
I do.
All right, well, hey, let me show you what the outcome can be like. We scanned you already, and we can see here's your before, here's your after.
Wow.
And we can achieve that anywhere from 4 to 6 months, depending on what the case is like.
Okay.
I want to tell you about one of the benefits about Invisalign is straighter teeth, obviously, a much better smile, but also healthier for your overall body and gums. When we have crowded teeth, we actually collect a lot more bacteria, and it has a lot more susceptibility to both gum disease and cavities. So you'll get a lot, protection on those. So just so you know, there's 2 types of Invisalign that we offer here. One is the comprehensive and one's the express. The comprehensive case is if you never had braces before, your teeth are a lot more spaced out. Usually those are about 12 months or so. The express case is our more popular option. That's for adults who've had braces before and they just have some revisions they want to make because they didn't wear their retainers most likely. So usually after 2 to 4 months, the teeth go back to normal, and that's our most popular option, which is the express case. So next time I see you, we'll bring you in, we'll add the buttons. The buttons are like the brackets for the aligners, like the metal brackets, but these are invisible buttons, and they actually help the teeth move in the aligners. We'll get the aligners back in about a week or 2. We'll attach them to you. You'll take it out every time you eat and drink. You'll pretty much sleep with them. They'll be your best friends for every day. Every week you change out the new trays. We'll give you the trays to go. We'll check in on you once a month, and after a couple months, you should be done. So yeah.
Okay. Sign me up.
So here at Shea Dental, we accept most major insurances for your dental care. We also offer an in-office discount plan. This option is great for senior citizens, entrepreneurs, students, or anyone that does not have a current insurance plan. If this is something that interests you, come and see us at the front desk and we can give you a brochure and go over all of the information for you.
Over the last few years, there has been a 3 times increase in the amount of patients who have something called bruxism. Bruxism is when you clench and grind your teeth at night. At Shea Dental, we have a machine that actually prints night guards for us. We have a 3D printer that makes custom-made night guards that are custom-made and perfectly fitted for your teeth. The way the process works is we scan your teeth, that takes about 5 minutes. We then send it to our AI platform, and that designs your night guard right online. We then send that to our night guard maker, the 3D printer, and that takes about an hour. We then wash, cure, polish, adjust, and deliver back to you, and the total time takes anywhere from 1 to 2 hours. Our night guards are special, and the material that we chose is hard, but it actually has some flex to it. So it's actually really comfortable compared to some of the night guards that previous labs have made for you before. If you're interested in your own night guard, or you're having issues with your current night guard, talk to one of our specialists. The process can take 5 minutes out of your day, and we can get you a lot of benefits and added security to protect your teeth for a long time. We just added Zoom whitening to our special services here. How that works is you come in, we sit you back, about an hour later, you'll leave with your teeth 4 shades brighter than what they were before. With the addition of Dr. David to our practice, we can now offer implants and overdentures to our patients here at Shea Dental. Dental implants are a great replacement for missing teeth. How it works is through the dental implant surgery, we put a post into your bone, we let it heal, we then put the crown on top of the post, and it acts just like a normal teeth. You floss like a normal tooth, you chew on it like a normal tooth, and best of all, it does not come out at night. With dental implants, we're able to offer something called overdentures. With overdentures, we're able to attach a patient's denture to their implants, and it acts like their whole teeth are back to normal again. You don't have to take them out, you can chew on steak, chew on apples, and you're back to how life was before you lost your teeth. Traditional dentures can only give you about 10 to 20% of your chewing force. With implant overdentures, you regain almost 100% of your chewing force back to what it normally was. You've probably heard about dental crowns before, but let me tell you about onlays. Because we have the technology here that can make ceramics in-house same day with no temporaries, we're able to do something called onlays, which are a way more conservative ceramic. If there's any healthy enamel left over, we can actually leave that enamel, bond in the ceramic like a puzzle piece, and get you your tooth back to whole. Instead of doing a crown that takes away 100% of the enamel, we can take away only 50% of the enamel and have just as much strength, just as much durability, and the great looking result. Here at Shea Dental, we have a CEREC machine, and what that CEREC machine does is it makes crowns, onlays, and veneers, and that means we can do everything you need same day, all in-house, no lab, within 90 minutes. In traditional dentistry, most patients are used to coming in, getting the crown done, getting a temporary, wearing that temporary for 2 weeks, coming back, getting numb again, and having the real crown put on, and then leaving. With us, you're in and out in about 90 minutes, no second appointments, no second numbing, you're good to go. Shea Dental has the highest technology you can have in a dental office, and one of the best technologies we have is our dental laser. What that does is if you have a cavity that we catch that's small enough, we can actually do the filling for you without getting you numb, no needles, no numbing, and about 20 minutes later, you're good to go and that filling is done. The laser is also great for kids. Because kids, I have found, are really worried about the needle, not necessarily the drill, we're able to do the filling for them without getting them numb and having them scared of the needle. After the filling is done with our laser, you can go on your day normally because you're not numb anymore. Ozone therapy is a holistic method that we can do here at Shea Dental with my training. Ozone therapy works by electrifying oxygen, injecting it around infections, cavitations, you name it, and that what that does is the O3+, which is ozone, disintegrates, and the plus molecule attacks all the negative molecules such as bacteria, viruses, infections, and the only byproduct you have is oxygen. The way it works is with the ozone generator that we have is we electrify oxygen through our medical grade oxygen, we then put it in a tube, we then inject it around the infection areas, and we let the magic go to work. We use ozone most commonly around old root canals that are failing. Instead of taking out the root canals, if the patient's not ready or it's small enough, we can actually inject ozone around those failing root canals to keep that at bay and the infection's gone. Within the IAOMT organization, I was able to get my AIAOMT, which is the accreditation within the Holistic Dental Society. There's only a few in the entire state of Arizona. I had to go in front of a panel, I had to make a presentation, I had to show them what we do here to holistically provide services to our dental patients. Being an AIAOMT provider means to the patients that I went on to additional training. I'm at the current technology with all holistic methods, and I want to keep our patients healthy and safe, not just in their dental mouth, but all across their body. I work with other providers, such as acupuncturists, naturopaths, and other doctors to make sure that you are healthy no matter what we're talking about. Being an AIAOMT provider, a lot of our patients are comfortable finding a doctor who understands that their issues, which may be more complicated, are at ease and able to be helped. With our holistic training, we use something called the Smart Mercury Removal Technique. This is a great way to remove those nasty mercury fillings while protecting your health. A lot of people out there just rip out the mercury fillings, they do not protect you, and they replace the teeth. Now what we do is we put you in something called the SMART protocol, which is a bunch of barriers, dams, chelation agents, protections, everything we do to protect your health and safety while we remove those toxic mercury fillings. We are only one of a few offices in the entire state of Arizona that protects you in the safe way of doing it, which is why we highly recommend using the SMART protocol if we ever have to take out mercury fillings from your body. One of the common appliances we make here at Shea Dental is sleep apnea devices. When we sleep, our tongue constantly falls back on our airway, causes us to snore, but what that does is it actually blocks our airway from getting oxygen down its throat, and that's bad for your sleep. It's bad for recovery, and it's bad for your overall health. What we can do here at Shea Dental is create a mandibular advancement device or a sleep apnea device, and that moves your lower jaw forward, and that allows your tongue to have more room and doesn't allow your tongue to block your airway. By having your lower jaw move forward, it actually allows the tongue to not block your airway and get oxygen down your throat for a peaceful night rest. A lot of our patients use these appliances because they hate their CPAP or they don't want to go on a CPAP device. This can easily travel with you wherever you go, and it's not cumbersome, and it's much healthier for you overall. Let's talk about veneers. A lot of patients want a brighter smile, they don't want to go through braces, or they're just not happy with how their current teeth look. With our veneers, I went through a lot of additional training up in Utah to specialize in more natural, holistic veneers. They look like real teeth, they act like real teeth, and people are not going to know that your teeth are fake. They're going to look like they're real. Here's how our veneer process works. First, you come in, we discuss what you want, they take some records. We send those records to the lab up in Utah, they do their magic, and about 2 weeks later, we can bring you back for the prep phase. At the prep phase, it takes about 2 hours. We'll get you numb, we'll take the teeth down minimally, we'll get them how we want them, we'll send that data off to the lab as well, and then 2 to 4 weeks later, we'll have you back in. In the meantime, you're in something called temporaries. The temporaries will look just like your real veneers, except we can adjust them how we want them. We adjust them as much as we want. We say, hey lab, this is what our patient wants, and then they make their real ones. After that, you come in, we get you numb again. About an hour later, we bond in the real veneers, and your new smile is good to go. Our veneers at Shea Dental are real ceramic. Some veneers are made of a composite material that only lasts about 5 to 10 years. With our ceramic, our veneers are expected to last 20 plus years. They're a lot more durable, they're a lot stronger, and they last a lot longer.